medications, and that's going to affect how stuff gets out of your body. And again, on and on, polypharmacy. Taking a lot of meds is an issue. So the risk-benefit ratio. Side effects of particular concern relate to changes in how medications can make you think. And we'll go through that a little bit with Parkinson's later. How they can affect your balance and coordination. They can change your eyesight. We don't always think about that. They can help you feel dizzy and fatigued, even though we don't want them to. They can make you faint or have your blood pressure drop so that you may fall. All of those things can increase the risk of falls. And then overall, in elderly, and I think this is so interesting, the people who use these Beers medications have a similar risk of falling whether or not they take them just once in a while or whether they take them every day, which I think is really very significant before we think about taking these medications. In fact, there was a 2005 study in the Archives of Internal Medicine that found residents who had an intermittent, so just a once in a while use of these Beers list medications were at greater odds of dying compared to people with no Beers list medications. I mean, that's significant. And if you're a stats person, just because I thought that was a shocking thing to say, I put the stats down there, the odds ratio and the significancy factor there, and that is significant if you're a stats person down at the bottom in parentheses, just so you know. Adverse effects can be nonspecific, like I mentioned, and we write them off as aging all the time. I hear people say it all the time in long-term care, and we just shouldn't. Really, because maybe it is a product of aging, but you know what, we may be making it worse with some of these medications. Specifically, anticholinergic adverse effects. And anticholinergic is a giant word that refers to a certain system in your body and how it affects, but basically, let's break it down like this. Anticholinergic side effects is how most people feel when they take Benadryl. So think about anytime you've taken cold medicine, maybe even NyQuil, which has a sister drug of Benadryl in it, or Benadryl, and you get that dry mouth, dry eyes, maybe even blurry vision. Your thinking is not as clear. I can attest to that from test taking in school after taking cold medicine or Benadryl. Unclear thinking is a big deal with that. Slow moving, urinary retention, meaning that your bladder maybe is not emptying as much. And as we know, if you don't empty your bladder a lot, bacteria builds up and you can get what's known as a UTI or a urinary infection. And constipation, which is a big concern in the elderly. I put slow moving on there twice. I'm not sure why. I shrunk that list up just so you can keep that in your head, because I want to talk for a minute about over-the-counter, those OTC sleep aids. They're almost 100% available with the active ingredient of Benadryl, which is diphenhydramine, or other sister antihistamines such as doxylamine. They are, and I put this in caps, not recommended for sleep in the elderly. They're just not. Neither are those herbal ones, like valerian or kava kava. Those things typically aren't good. They have all these same side effects. It doesn't matter that they're herbal. They're affecting the same systems. So same side effects. And they have been linked to liver failure. And for a while, actually, kava kava wasn't available over the counter. Now it's back. So be careful with that. Beers list, as I mentioned, you can prescribe drugs if you're a doctor that are on the Beers list. Doctors take into consideration people's specific situations, and that's important. But we also have to realize that the drugs need to be revisited in each person, and we need to really examine whether the risk-benefit ratio is appropriate. So remember that even though it's written by doctors, doctors know about it, there's even software that helps us learn about it, it's an ongoing issue and an ongoing area of concern. And I just want to give you a hard example. We may have all heard about Darvocet. It's a pain medication. There's also Darvon, which is a version of it. Darvocet, it's usually a big It's usually a big pink pill, and I hear that the pink version of it works better than the white version of it from my patients all the time. I don't know that that's true, but that's what they believe. It has an active ingredient in it called propoxyphene, and it's not a very good medicine. It's a narcotic, but it's not excellent. Darvocet itself actually is propoxyphene and Tylenol, so just to give you a hard example. So they've led to overdoses, both Darvocet and Darvon, and they're thought to be overall more addictive than they are pain relieving. So, and studies show that pain relief is only equal to that of just Tylenol. So Darvocet has Tylenol and propoxyphene in it. It may be just because of the Tylenol that it's working as little as it works. It's important to realize, though, that the side effects are the same because structurally it is a narcotic. So you'll get your constipation, you'll get confusion, you'll get sedation, and it still has those addictive properties. The FDA has done tons of reviews of efficacy on this, but one of the more recent ones on their website, there's a quote from it that says, there's evidence that propoxyphene, so that Darvocet, Darvon, possesses weak analgesic effects, so just not very good pain reliever, in patients with acute pain compared to placebo. So compared to nothing, it's not that much better, basically is what that means. And there's probably better choices. This is just a quick slide to let you know that Tylenol is an over-the-counter medication for pain and fever. The active ingredient is acetaminophen. I'm going to go back and forth between saying Tylenol and acetaminophen. And acetaminophen is so long, and I didn't want to take up a lot of slide space, so I abbreviate it to AP. AP, that's just sort of an abbreviation for you. That means acetaminophen. So when you see that, you'll know. Combination products, such as Darvocet N100, Tylenol with codeine, various forms of Vicodin, are, to some degree, we're worried about the narcotic component of those, but really the Tylenol component can lead to overdose. There's so much. That Darvocet N100 has 650 milligrams of Tylenol per tablet. Vicodin ES has 750 milligrams per tablet. That's a lot, because a typical prescription would read something like Darvocet N100, take 2 tablets by mouth every 4 to 6 hours if needed for pain. So they're saying you could take it maybe 6 times a day, maybe 4 times a day, but greater than 3 doses, you are above the risk for liver toxicity and death. So that is, to me, very meaningful. This is just a little breakdown of, right now, you shouldn't take more than 4,000 milligrams of acetaminophen in 24 hours, which is the same thing as 4 grams, which is roughly equal to your normal strength, about 12 tablets in a day. So if you're taking combination products, you can see how this may build up. There's actually, in the last 2 years, been a lot of movement to lower the maximum dose. And the FDA has gone around and around. You can look on their website and find out about that. The toxic dose may be lower in some cases because it's not only about dose. If you have liver issues, that's a problem. If you're taking alcohol, that's going to maybe lower your threshold. If you're taking other medications, that may lower your threshold. And it really has to do with pathways. I'm not going to get too into the pharmacology for you, but if everything's going along fine, you're in this one pathway. All of a sudden, you start to have issues. This gets overwhelmed. You start metabolizing it in this pathway. Sounds great. Sounds like we're taking care of it. This second pathway produces toxic metabolites that cause liver failure and death. There's no telling in each individual person when you switch over. So that's why we have to be really careful. And a lot of people sort of, oh, it's Tylenol, it's okay. But just so you know, Hepatology, which is a medical journal, did a study showing that 50% of acute liver failure cases, and liver failure is no joke, that leads to death very often, were related to Tylenol or acetaminophen poisoning. The FDA has a recent statement on their website that says the association between acetaminophen and liver injury is not common knowledge. Consumers are not sufficiently aware that acetaminophen can cause serious liver injury, and their perceptions may be influenced by the marketing of the products. So that's a big deal. Side effects of blood pressure meds. Well, if you take blood pressure meds, you might be aware of this, or you take care of someone who takes blood pressure meds, you might be aware of this, but they're common meds. So I wanted to say that they can be sedating. They can affect your heart rate. So even if you're exercising, your heart rate's not going up. And that's intentional. They're meant to do that, but it can be a surprising side effect. They can cause depression, in particular the ones I have listed here, metoprolol, carvedilol, labetalol, clonidine. They can cause dizziness. All of them can cause confusion to some degree. And I have the meds listed here, but really just to know that a lot of blood pressure meds can cause these is the point. They can change your electrolytes. They can increase or decrease your potassium or sodium. We all know even from watching TV that can cause heart failure and heart attacks. That can be a problem. Hydrochlorothiazide, lisinopril, spironolactone, Lasix are some I could think of. I was recently in a bathroom in a mall in Tucson, Arizona, and a woman about 3 stalls down passed out. Her daughter started screaming bloody murder. Someone help. My mom passed out. Someone help. I went over. Woman, was awake pretty quick, came back, was able to be oriented pretty quick, and interviewing her, I found out she had recently started this water pill, hydrochlorothiazide. It's hot in Tucson. She hadn't adjusted her water. I don't know that her potassium was where it was supposed to be. I didn't have lab results. We had to call EMS for her. There's several physiological reasons caused by this medication that could have made her do this. So, that's an issue. If you're a man, this is often written off as just, oh, well, whatever, but I think this is a significant side effect to worry about if you're a man. If you're a man and you're taking aldactone or spironolactone, you can grow man breasts. It's called gynecomastia. And that's not comfortable if you're a guy. You probably don't want to walk around like that, so that's something to know about. Digoxin is a med that affects your heart rate, and what we really need to know about that one is you can be